Hello everyone and welcome to the ESC Snacks from the ESC 365 Congress, and this is the last day of the conference and we had some nice trials being published today. My name is Stefan Simovic and I'm sitting here with Professor Marco Roffi from University Hospital of Geneva in Switzerland. Welcome, Marco.
Thank you, Stefan.
Can you tell us about the trials, specifically about My Heart, Your Heart trial that has been revealed quite recently, a couple of hours ago?
Yes, let me tell you that this Hotline 9 session was really exceptional. And I may dare to say that maybe it was historic because 3 out of the 4 Hotline trials were performed in low and middle income countries. So this is really unique and is actually well in line with the focus of this year meeting, which is global health. So this was really a great event. With respect to the study My Heart, Your Heart, I think is a very interesting one. Actually, the investigator looked at randomized 306 patients who necessitated a pacemaker, but did not have the money to pay for it in low and middle income countries. They were randomized to a new pacemaker device or to a reconditioned pacemaker device. Obviously, the reconditioning was made in very proper and thoughtful manner. And the idea was to look at whether the rate of infection at 1 year, so the primary endpoint, would be different. And actually, this was non-inferiority trials. And there was no significant difference in the rate of infection between the new pacemaker and the reconditioned pacemaker. Actually, with some surprise, numerically, there was an increase in infection in the new pacemaker group with a rate of 2.8% as compared to 1.4% in the reconditioned arm. So clearly this met the non-inferiority request. Then obviously the investigator looked at other endpoints such as lead dislodgement, and in that respect there was no significant difference. Numerically a little bit more in the reconditioned pacemaker arm, but overall a very elegant trial suggesting that the reconditioning pacemaker that were extracted from people who were deceased is an alternative way to treat patients with bradyarrhythmia that cannot afford a pacemaker.
Yeah, thank you, Marco. Such an important trial. Again, can you tell us the clinical implications of this trial?
I think, it's really sad to think that nowadays people can still die because of complete AV block. So this is something that needs to be addressed. There are 2 ways of addressing this. One would be to have a very low price single chamber pacemaker. This obviously needs also to be addressed so far with no success, but I'm sure there should be charitable funds and other funds try to support this. But the other way is really to explant a reconditioned pacemaker in order to allow those patients to survive. And this study suggests that this indeed is a valuable option and an ethical one also.
Yeah, great. Thank you very much. But beside My Heart, Your Heart trial, the Parachute HF trial has been revealed. Can you tell us something more about this trial?
Yes, again, this trial was also performed in low and middle income countries, especially in South America, looking at the population that has very little been studied so far, namely patients with Chagas disease and heart failure. We know that those patients have a far worse outcome than comparable patients with, let's say, standard heart failure. And the investigator addressed the treatment and compared enalapril to sacubitril valsartan to see whether there was a difference. It was a hierarchical combined endpoint of cardiovascular death, rehospitalization for heart failure, and the change in NT-proBNP at 12 weeks. Overall, the study was in favor of sacubitril/valsartan. However, we have to admit that the benefit was driven entirely by the difference in the NT-proBNP level. So no difference in cardiovascular mortality, no difference in the rate of hospitalization, but a clear 30% reduction in the rate of NT-proBNP levels with the composite compound.
Thank you, Marco. And indeed, this is the trial population that has not been investigated very much so far. But can you also tell us what could be clinical implications for this trial?
So let's say, as the commentary was done by Scott Solomon, and actually he said that obviously the results were somehow comparable with let's say, standard heart failure trials. So it goes in the same direction. Obviously, this study was not really powered for clinical endpoint, but clearly this compound is a good alternative to standard ACE inhibitors in those patients.
Thank you, and definitely we need more trials to investigate this population with these medications in order to get, as you said, hard clinical outcomes.
Yes, and this actually is really in the spirit of the ESC, because the mission of the ESC is to reduce the burden of cardiovascular disease worldwide.
Yeah.
And in this meeting, especially in conjunction with the World Heart Federation, I think that the society clearly demonstrates the interest in doing that.
Thank you, Marco, and thank you, audience, for watching the ESC Snacks.